doing?
Yeah, so this is Amy Herbst, right? Okay, and you are the Vice President of the Mental Health and Behavioral Health here at Children's Wisconsin. And, you know, one of those things is, we didn't talk about mental health for a long time. You know, it just kind of was stigmatized maybe, it just wasn't at the forefront. And then we realized it really needs to be. And you can't really take care of the whole child unless you're making sure that their mental health is taken care of. And it's become such a huge part of what goes on here at Children's. So as the Vice President of the Mental and Behavioral Health here at Children's, and your work as a social worker, why don't you take us through where we are right now and what Children's is doing to help kids with their mental health?
Yeah, thank you. Thanks for talking about this today. You're helping right now to reduce the stigma, so we appreciate that. I would say where we are today is so much better than where we were last year, where we were years before that, and we still have a ways to go. So we know that our kids are suffering in terms of their mental health across the nation, and that remains true here in Wisconsin as well. And I say we're better off today than where we were a few years ago, and that's really thanks to our executive team here at Children's, our board, and absolutely thanks to the community, because in 2019, Children's made a commitment to improving kids' mental health, a significant commitment. And we've been on that journey ever since. And I'm happy to say we have done our parts, along with many others in the community, to improve kids' mental health. So we are busy right now integrating mental health care into all of the care that we provide kids when they come to any place of Children's. So we're not missing that opportunity. If you're here with us, let's say in the dental clinic, and that's the only reason why you come to Children's, we want to screen you and see how you're doing in terms of your mental health. So I would say we're better off because we are really doing our part to make sure mental health care is part of the care we provide all of our kids.
Integrating checkpoints and questionnaires and things like that that occur when people get admitted?
Yes, absolutely. So one of the things that we know is that sometimes kids will come here to Children's, let's say for a sprained ankle, and they'll come to the emergency department. That's what they present here. We don't want to miss that opportunity to check on their mental health. So we are screening our kids 10 and older in the emergency department to make sure they're doing okay, and we're specifically screening them for suicide risk. And so we see kids who come for a sprained ankle. They fill out the screening in the emergency department on an iPad. It's real quick and easy. And what we've seen is some of those kids will screen positive for risk of suicide. We have the opportunity right then and there to bring somebody in that emergency department room and start to address that mental health concern in that moment, and we'll stay connected to that child and their family going forward until they get all the mental health care that they need. That's one example of many. It's how we do business now here at Children's.
It's amazing to me the statistics of how many children are seen. So this just says since 2020, the Access Center has handled 172,000 calls with families that are looking for services, scheduled follow-up visits, and then mental health appointments because of those assessments. And my kids had children's doctors, you know, their primary care doctors were a part of the Children's Network. And I remember when they started getting those surveys to fill out and how far it's come. And like you said, still very far to go. But every person that walks into a walk-in clinic or to a doctor's office, or like you said, to the emergency room, fills out one of these surveys to kind of gauge where the kids are. And that's where you're helping to save lives as well.
Right, absolutely. We have therapists integrated into all of our pediatrician clinics now. We have health psychologists integrated into all of our specialty practices. We have mental health providers integrated into the emergency department. The list goes on and on. And so in all of those cases, what we're able to do is screen kids for anxiety, depression, and suicide, see how they're doing or maybe not doing, and literally act right in that moment. So lots of opportunity to say, yes, you're here maybe for a physical, a sports physical at your pediatrician office. We're going to check on your mental health too. And if you're needing any help, the therapist walks right in the room and starts providing the care for families right in that moment.
We're talking with Amy Herbst, the Vice President of Mental and Behavioral Health at Children of Wisconsin as we continue with the 2026 Miracle Marathon. Is it a numbers game too? Like you need to increase the staff members every year in order to meet the demands that you're facing?
Yes, absolutely. So there's a national shortage of mental health providers, and that's true here in Wisconsin as well.
Yeah.
So we're doing many innovative and unique things to try to grow the workforce that we need.
Yep.
Because kids need a different kind of therapist or psychologist or psychiatrist than an adult needs.
Sure.
So that makes it even a little bit more difficult to find the workforce that we need. But we're doing really well, having a lot of success, and I'm sure we'll be on this journey forever to find the right providers for our kids.
And tell us how donations like that we're collecting today, how is that helping in this process?
Yes, absolutely. Without the support from the community that we've received all of these years, I can tell you that there are things we wouldn't be able to do without that support, or things that we would not be able to do as rapidly as we can with that support. So we rely very heavily on support from the community, whether that's a dollar raised or them talking about mental health and reducing the stigma. All of that matters to us. But really, it is thanks to the community that we are able to do what we're doing today. We were able to get integrated therapists into the pediatrician offices really rapidly, thanks to the Ubuki Family Foundation gift. We've been able to do all of the screenings that we're doing across the state and with all of our kids, thanks to some philanthropic gifts. We've done some very innovative things to create the workforce that we need. There's not funding for some of this. Creating that workforce, it came through a gift that we received many years ago from the Bolt family that lives on still today. So all of those gifts really allow us to do things that we really wouldn't be able to do without it otherwise, because there's not the funding that you need yet for mental health the same way as there is for physical health. That's still a journey we're on. But we've never let it stop us, because the community has shown up the way the kids have needed, and they have provided the support that allows us to do all of these things.
Well, as Amy is talking, we're seeing some other families we've talked to in the past. We're seeing the phone bank of volunteers ready to take your calls. So help out now if you can. 414-337-WKLH is the number. That's 414-337-9554.
And right now it's a power burst thanks to C.G. Schmidt Company. So every dollar that you donate until 1 o'clock is being doubled. So now is the time to donate. Amy, thank you so much for your help and your information and being a part of today.
No, thank you, and thanks to the community as well.
And thanks to all the volunteers I just mentioned back there, working hard on the phones, making those phones ring. 414-337-WKLH. That's 414-337-9554. Also, special thanks to Craig back in the studio, who normally is afternoon drive on KLH, and he's helping us run the board right now as well, so we can do our job better. The Miracle Marathon continues now on Milwaukee's Classic Rock 96.5 WKLH.